Hey guys, Curtis Alexander, I'm a pharmacist. In this video, let's talk about the side effects that we can see with Tramadol. Now, as you're probably aware, Tramadol is a prescription medication that we use to treat pain. Now, it's important to understand what it's doing in your body. That will help explain some of the side effects. So what we know is it is binding the opioid receptors in your body. That does decrease the amount of pain you'll feel. It also has an effect on your norepinephrine, which is basically adrenaline, and also serotonin. It inhibits the reuptake, so you're going to see your levels go up of norepinephrine and of serotonin. That's going to become important later, okay? Now, side effects. Let's just talk about the most common things you can see, and then I'm going to go into some of the more rare things that you want to be aware of. Not as common, but can be very serious. But right now, these are more common, not as serious. One of the more common ones we see is constipation. We can see this, as you can see, 9 to 21% of people. Now, you're going to see ranges on these side effects. The range goes up higher. You're going to see more of them as you go higher dose, and also if you use the extended release formulation. So ideally, trying to avoid high dose extended release to stay away from the high end of the side effects. We can also see nausea happen in 15 to 26% of people, dry mouth 5 to 13%. Dizziness is a big one that I hear people talk about a lot, 10 to 23%. Drowsiness 7 to 16%. And interestingly, headache, you think it would help headache, but we have 12 to 23% of people experiencing a headache when they take Tramadol. Now, let me point something out. I have a link in the description. If you are suffering with pain right now, I cover some more natural options to get you away from drugs and surgery if you're suffering with pain. So make sure to go get that free checklist. Right now, I talk about some safer, more natural options. Now, let's talk about some of the big warnings you need to be aware of if you and your doctor are considering Tramadol. Number one is CNS depression, CNS, central nervous system. So we can get people that have a really tough time with the drowsiness, really tough time with very lethargic, not thinking clearly, those sorts of things. You do want to kind of keep an eye on your sodium levels. We can see sodium drop off. Again, another serious one, respiratory depression. You dose too high on Tramadol or people react funny, have trouble breathing, obviously pretty serious. Seizures is another one. Whether you have a current seizure disorder, you want to be very careful, or if you're taking other medications that will inhibit serotonin reuptake and cause serotonin levels to go up. Obviously, we talked about Tramadol does that, so we need to be very careful with SSRIs or SNRIs. Those are selective serotonin reuptake inhibitors or selective norepinephrine reuptake inhibitors. An example of one of these would be like Prozac, Zoloft, those sorts of things. Serotonin syndrome, again, because Tramadol has the ability to increase serotonin levels, you want to be careful with any medication that you might be taking right now that causes serotonin to go up. So make sure that your pharmacy runs a drug interaction check. All of them usually do, but just be aware of that. And finally, withdrawal syndrome. Withdrawal can happen with Tramadol. We've even seen it happen in people who are taking it short term, so it doesn't have to be taken long term to experience withdrawal. Usually you're going to see symptoms in around 24 hours, the first 24 hours, and that may include things just kind of a flu-like feeling, body aches, nausea, those sorts of things. It can last anywhere from 2 to 7 days. Probably one of the biggest risk factors is your dose. The higher a dose that you are on, if you go off it rapidly, which you do not want to do, your risk of withdrawal does go up, okay? So that kind of covers side effects, guys. Let me know in the comments, have you taken Tramadol? Did you experience side effects? If so, what were they? It's helpful for me to get your guys' feedback. And anybody else that's watching this video, I promise you a lot of them read those comments. So your feedback is really appreciated. So speaking of which, I hope this video was helpful. I'll see you in the next one, guys. Thank you.